Tonight, we have a presentation by Mary-Kayt Jones, who's a genetic counselor at the University of Iowa Hospitals and Clinics. She's going to talk about the title as indicated there, and so direct-to-consumer testing and when it would be appropriate to contact a genetic counselor. After I communicated with Mary-Kayt about her giving this presentation, there was a story that came up in Stat, the online magazine, about someone finding out that they were a breast cancer carrier of a susceptibility mutant, and sort of struggling with that on their own from their 23andMe results, and then dealing with a genetic counselor and going through that result with them. And so Mary-Kayt's going to give some perspective on what genetic counselors can do for you after learning something from a 23andMe test. Mary-Kayt Jones was actually a student in the Personal Genome Learning Center before she went off and got her degree in genetic counseling, and so she did work with us a brief period of time as a student before going off to school and then coming back and getting hired by UIHC. And so it's a welcome pleasure to have Mary-Kayt tonight.
Thank you so much for that introduction. Can everybody hear me okay? Okay. I've been told I'm a little, I've been told I'm a little bit of a soft-spoken, so just, give me this if you can't hear me. Exactly, I'm going to talk to you guys a little bit about when you might want to consider seeing a genetic counselor when it comes to direct-to-consumer genetic testing test results. So first, I'm just going to give you guys an outline about what I plan on talking about today. So specifically, I plan on talking about who are genetic counselors and the specialties that we're involved in, where you can find a genetic counselor, the genetic counselors particularly that are at the University of Iowa Hospitals and Clinics, there are many of us, as well as when it might benefit you guys or anybody in general to see a genetic counselor when it comes to your results from 23andMe or any other health-related direct-to-consumer testing platform. So first, I just wanted to do a quick, just ask a few questions. So many of us maybe have heard about, direct-to-consumer testing or have done them ourselves. And all over these platforms, they say something like, consider talking with a genetic counselor, or free consultation to see a genetic counselor, connect with a genetic counselor, or click here to find a genetic counselor. But many people actually have never heard of what a genetic counselor is or even knows what a genetic counselor is. So I was just curious if anyone wouldn't mind raising their hands. Have you ever heard of a genetic counselor before today or have met with a genetic counselor? Okay. Oh, I'm really surprised. So this is wonderful. Most people have never heard of a genetic counselor before, don't know what it is, what we do. So I'm happy to hear most people have actually talked with a genetic counselor or met with one. So I'll talk to you a little bit more in detail about who are genetic counselors, just so everyone's on the same page for those of us who maybe have never met with a genetic counselor or have never done any research to kind of figure out what we do. So genetic counselors are trained healthcare professionals who are educated specifically in both genetics and counseling. So that counseling piece kind of gives us information to kind of handle some of those emotional aspects that test results can provide for patients. We provide personalized guidance to patients who may need to make decisions about their genetic health. So those who maybe are thinking about whether or not they want to perform testing or not, and the pros and cons of that testing to see if it's appropriate for them. We do promote informed choice. So when you meet with a genetic counselor, we're not saying you have to do genetic testing. It's just a conversation to see if genetic testing is best for you at that time period in your life. We support individuals and families who are at risk for or diagnosed with a variety of different genetic and inherited conditions. And I'll talk a little bit about all the different specialties that we do, because there are many genetic conditions out there. We are genetic translators for each individual's level of understanding. So all of us have a different level of understanding when it comes to genetics. And so genetic counselors are trained to be able to discuss genetic concepts in a level that everyone should be able to understand and in multiple ways. We educate our families, our individuals about inheritance, the testing, your management and prevention strategies. We give families resources, as well as some genetic counselors work in research and so might talk about research opportunities to families. Genetic counselors also help individuals adapt to the medical, psychological, and familial implications when it comes to genetics. So I mentioned that sometimes learning that you have a genetic condition, or you have a family history of a genetic condition, can be really impactful and affect everybody in different ways. So we kind of help explore some of those emotions and kind of help talk with families. And then lastly, we're huge advocates for our patients and part of their support team. So our main goal is to be there for our patients in any way that we can be. So now you know a little bit about kind of all the various roles that we can do or what we are. This is kind of just a general layout of some of the things that might be covered, like in a typical genetic counseling session. This is definitely not exhaustive. I know it's a lot of words. But we mostly, when you come to a genetic counseling session, the genetic counselor will take a 3-generation family history and talk to you about your family history and interpret it. So talk about if there is anything of concern or anything that you might be concerned of personally. We might take a medical history and talk to you about those implications. We might review genetic tests that might be right for you or maybe not right for you and discuss exactly what that genetic test is looking for. We help patients feel empowered to make their healthcare decisions. So again, this is not something that as a genetic counselor, we're not telling you you should do this test and this is why. We're talking about your options and helping you choose the option that's right for you. So making you feel empowered to choose whether or not you choose to do genetic testing or not. If you do genetic testing, we're here to interpret those results. So you're not left to get something coming to you in the mail and have to go on Google or online and try to figure out what all this means. We're here to help walk you through those steps. We discuss the chances, depending on the condition and what we're looking for, whether or not, what's the chances the disease occurred, the inheritance, the recurrence risk to other family members. We discuss how genetic tests might impact you and your family specifically. We'll provide resources, like I said, support groups and information should you need that. And then lastly, we're here mostly to listen to your concerns and answer your questions. So this is a session for my family, it's not necessarily for me. So I'm here to kind of listen to what you guys want, my patients want, or what anybody wants to come to see a genetic counselor, what their main concerns are, and make sure that we address them. You should never leave a genetic counseling session being like, they totally missed the point and I got nothing answered that I needed to. Never leave that way. They should always ask up front kind of what your concerns are and to make sure that we address those in the session. Okay. So now I talked a little bit about what genetic counselors are. Where are we? Where can you kind of find us? So the first genetic counseling program actually started in 1969, so it's about 50 years old now. And so that's why I was a little surprised. A lot of people haven't heard of genetic counseling because it hasn't been around that long. There's only about 5,000 of us out there today, so we're kind of far and few between, but you can find us. And we're mostly located in hospitals or university academic centers or in genetic testing laboratories. You can find a genetic counselor. There are other areas that we work in, though, as well. So you might find a genetic counselor at a private hospital, a private practice, a not-for-profit organization, I can't talk, government agencies, as well as internet or website companies like 23andMe. 23andMe does have a genetic counselor, just one, but she is there. So we work in many different specialties within these organizations. So prenatal genetics is actually where I work. I am a prenatal genetic counselor and actually houses most of our genetic counselors work in prenatal, but we work in many different specialties. Most commonly, other big areas that genetic counselors work in is pediatrics, as well as oncology or cancer genetic counseling. There are genetic counselors in cardiovascular, neurology, maybe interpreting lab results with genomic medicine, metabolic diseases, and I put even more on the side here. We have genetic counselors in research, we have genetic counselors in advocacy settings, government, and then of course the direct-to-consumer companies. Okay. So we're kind of everywhere. If you know which specialty you want to talk with a genetic counselor, and you can kind of go to that genetic counselor that knows most about that specialty. And to kind of, I'll talk a little bit about the genetic counselors here in Iowa City, but we have family all over the United States or all over the country. So that means if you have family who want to see a genetic counselor, but they're not housed in Iowa. So this is kind of a website held at the National Society of Genetic Counselors. It has a page of how to find a genetic counselor. So if you put in find a genetic counselor in Google, this should pop up right away. And then you'll click on in person or by telephone, it'll put where you live, and it should come up with a list of all the genetic counselors closest to you and the specialties that they work in. So that can be helpful if you say, I want to see a genetic counselor only in cancer, you can narrow down that list so you're not having to reach out to many different people. Okay. Yeah, so the National, oh yeah, sorry about that. Yes, National Society of Genetic Counselors, or NSGC. So that's kind of how you find genetic counselors in general. I'll walk through all the different genetic counselors here at the University of Iowa hospitals and clinics, just very briefly what we do. There are about 20 genetic counselors at the hospital right across the river. So this is kind of a little bit about what we do in case you ever need to see a genetic counselor in one of these specialties. So like I said, I work in women's health, particularly doing preconception and prenatal genetic counseling. So I see individuals who are maybe interested in genetic screening or the testing options in pregnancy or thinking about pregnancy, maybe doing carrier screening, a family member they know is a carrier of a genetic condition like cystic fibrosis and wanting to know if they're a carrier as well. Maybe they have a family history of birth defect like a heart defect. They have a family history of a genetic condition or a chromosome abnormality. They would come see a genetic counselor to talk about that. I see people who have high-risk pregnancies, who have fetal ultrasound findings, or recurrent pregnancy loss. So I see a kind of range of individuals that coming for specifically to talk about genetics related to these indications. The University of Iowa also has pediatric genetic counseling or medical genetics, so I see adults as well, not necessarily just pediatrics, but I think everything is housed in the Children's Hospital. But they see individuals, these genetic counselors see individuals with abnormal newborn screening. So after a baby is born, if that comes back abnormal, you usually get connected with a genetic counselor. If it's a particular condition that can be carrier screened, if it's recessive, they'll test parents. So you might end up getting carrier screening offered to you in that situation. They see individuals with a birth defect, or maybe a learning or behavioral concern or a growth difference to talk about could there be a genetic cause for those findings. They meet individuals who have family history of a known genetic condition to talk about could that be happening in their child or what are their risks for future children. Usually a medical geneticist is present with the genetic counselors in this particular specialty, and they have several clinics that, depending on the indication, that patients can get seen in. So whether it's just general genetics, they have special connective tissue disorder clinics. Neurofibromatosis is a particular genetic condition they have a clinic just dedicated to. Metabolic genetics as well as adult genetics. So they're kind of a catch-all after birth. The university also has a genetic counselor who is specialized just in cardiovascular genetics. So she meets with individuals or family members who are under the age of 60 who've maybe had a problem with heart conditions. So particularly like cardiomyopathy of heart failure, connective tissue disorders such as Marfan syndrome, arrhythmias or irregular heartbeat. We'll meet with one of her, as well as usually a cardiologist. Some individuals might have an aortic aneurysm or have a family history of aortic aneurysm, and so usually they get referred to a cardiology genetic counselor. Those who've maybe had a heart attack or stroke at a young age, they might go to a cardiac genetic counselor to talk about their family history and review maybe could there be a genetic cause that could make your chances higher, for instance, for developing that. Or if you have a family history of unexplained sudden death, maybe from an accident like a drowning that no one really knows what happened, that could be an indication that maybe something was going on with the heart. And so sometimes you always get referred to genetic counseling to kind of talk about that family history to see if there's anything that could be of concern to look further into. And the genetic counselor there always discuss testing options and the impact for treatment in family, particularly to the cardiovascular genetic conditions that might be in someone's family history. We just recently, as of like a few months ago, got a genetic counselor who specializes in hearing loss, so that's exciting. So she specializes in maybe babies who are born with hearing loss or maybe a child who developed hearing loss at an early onset and having really no answer as to why that happened, no environmental impacts or anything like that or infections that could have caused the hearing loss. So maybe doing a workup to see if could it be genetic. She meets with people who have a family history of hearing loss, such as sensory neural or conductive hearing loss, as well as syndromic hearing loss. So there are some forms of hearing loss that are genetic that present with other findings besides just hearing loss, such as hearing loss and maybe you have kidney problems or you have hearing loss and vision changes. If you see multiple things, that might prompt the doctor to refer you to genetics to do family history and talk about if this could be something of concern. And they always talk about genetic testing options and carrier screening because a lot of these conditions are inherited in a recessive form where both parents are carriers but healthy but go on to have a child that could have that condition. So they talk about that as well. We have a genetic counselor in nephrology at the University of Iowa, so specifically just kidney disease. It's all she does. So she meets with those who have had kidney disease as a child or in adulthood. Those who maybe have had a renal ultrasound and found out they have polycystic kidneys or kidney failure or a structural kidney abnormality or a missing kidney. Usually they meet with a genetic counselor just to talk about maybe there's a family history of kidney problems and maybe there's an underlying condition or a risk for having a child with the same things. And there are some syndromic forms of kidney disease that she would work up as well. So hearing loss and kidney disease can sometimes go together if you have one individual who's got both, or heart disease and kidney disease. So kind of piecing together when taking that family history, the genetic counselors are thinking about all those things. Okay. We also have neurology genetic counselors. We have quite a team there in neurology. And these are individuals who they work with individuals with a family history of a genetic condition which particularly affects the nervous system. So usually it's accompanied by a neurologist. So usually it's a genetic counselor, but also a doctor as well, coming in to do a full assessment and workup. They would discuss genetic testing options for maybe whatever they're concerned about in particular. They also do pre-symptomatic genetic testing if those have a family history of a neurological genetic condition that they're concerned about, but maybe don't have any symptoms of it themselves, and talking about that process to get testing for that. They talk about the impact of these conditions, specifically to maybe an individual, but also their family. Talk about management and prevention strategies, and some conditions I listed here that they kind of meet with families with, so like Charcot-Marie-Tooth, Huntington's disease, early onset Alzheimer's disease, so like Alzheimer's disease in your 30s or 40s, as well as early onset Parkinson's disease. And this, of course, is not exhaustive. They see many patients for any type of nervous system abnormality or concern. And then lastly, we have genetic counselors in oncology. So this is also a pretty big area within the hospital that genetic counselors would see individuals for. So those who have a family history that's really strong for certain cancers. So we think about 10% of all cancer is thought to be hereditary or run in families. Doesn't mean that 10% of cancers are genetic necessarily or inherited, but there is a strong family history, then it always prompts to go see a genetic counselor to talk about things further. So some indications that might prompt a referral for a doctor to send someone in to go see a cancer genetic counselor, or maybe you yourself want to go see a cancer genetic counselor, is maybe you have a family history or a personal history of young onset cancer, so cancer less than the age of 50. Maybe you have 2 or more separate cancers that happen to one particular person, and that warrants usually a concern to maybe go talk with a genetic counselor. Maybe you have a family history, a strong family history of one type of cancer, like colon cancer, and so you want to go talk with someone about that. Or maybe you already know that there's a family history of a genetic change that causes cancer in your family, and you want to know if you carry that change. That is also why you would go see that particular cancer counselor. They review your personal and family history. They'll just discuss your testing options and whether you're not at an increased chance to develop certain cancers or not. And they'll discuss the screening as well to prevent or detect cancer earlier. And some examples of inherited cancers are things like breast and ovarian cancer, colon cancer, and uterine cancer, but there are more rare cancers and things like that that they know a lot more about. Okay. So that's kind of a summary of what genetic counselors are and the many different specialties we have over at the hospital. They're accessible to all of us. So I just wanted to do a nice general overview about what genetic counseling is in relation to the direct-to-consumer testing, because most of us have either, like I said, heard of genetic direct-to-consumer testing like 23andMe, or have done it ourselves and maybe seen the pop-up of a talk to a genetic counselor. So wondering, just kind of looping it back to when you might want to see a genetic counselor, what indications might be more appropriate to see a genetic counselor when it comes to particular direct-to-consumer testing results. And so when we do these tests, we all kind of do the direct-to-consumer testing, or I'm just going to call it DTC, for many different reasons that can maybe drive us to kind of spit in a tube and send it off. Sometimes we might do it for fun things. We learn fun information like our favorite ice cream flavor, whether that be chocolate or vanilla. They try to predict if you have curly hair or straight hair, if you're going to predict taste bitter food or not taste bitter food. So it can be kind of fun to see, okay, if they're looking at my DNA that I spit in a tube, how accurate can they get? But also, these companies now are starting to report on health information. And do we really want to know all about our health information? How accurate is it? How do they get to that information or those test results? And I'll talk a little bit about that. So before I kind of go into how the testing is done in relation to the test results that can come back from these 23andMe or other testing platforms, I was just curious, we all have different motivations for doing these type of testing, and it's always helpful for healthcare providers to kind of understand a little bit about why someone might want to do these testing. So I just thought maybe I could go through some of them and see if anybody in particular, if they know why they maybe wanted to do the testing. So if they did it, maybe they sent their testing off because they were just kind of curious and wanted to know what would happen. I know I've done it, so that's why I sent it off, was because I was curious. Some maybe were proactive about their health. They just wanted to know as much information as possible. Does anybody here send it off because of that? Maybe they're interested in learning more about their genetic risk factors. Maybe you're seeking self-identity. Family history. Maybe you have a known family history of a genetic condition or an unknown family history and just want to know a little bit more. Okay. And distrust in the healthcare system. You can raise your hand if you want. I won't take offense, but there are some people who just don't trust the healthcare system, and they'll get their answers their own way. This is particularly for health information. I know a lot of people maybe might do direct-to-consumer testing for the ancestry piece of things, which is pretty good as well. I won't talk too much about that, but I know that's also a big factor as to why somebody might want to send off for direct-to-consumer testing. Okay. So we all probably know a little bit about how this testing is done. You order a kit online, you spit in a tube, they look at your DNA somehow, and you get results in a computer a few weeks later. Kind of seems like magic. So they do just from a little bit of spit. That maybe takes some people a little bit longer to collect than others. But really, how accurate is this testing, and how different is it really than the testing you might get at a doctor's office? Is it the same type of test, or are they doing it a different way? So I'll talk about that just very briefly. So the direct-to-consumer testing that we do, like when we spit in a tube and mail it off, is actually performing something called genotyping, whereas the testing that you get done at a doctor's office and send off to a laboratory is something called sequencing. So there's pictures of some books up here, and so essentially I think of genotyping as maybe you open up a cookbook and you just read a few quick words on each page, like, I don't know, oil. You see oil a few times, and that's all it's looking for. It's just looking for the word oil, and that's it. So it's hard to really learn more about the cookbook and the recipe and what's being made. Whereas sequencing is actually looking at every single word on that page and using it to interpret everything going on. So it has more of that context. So I kind of wrote also out genotyping. It reads only a few words on a page, and it's looking for a few predetermined words, or what we call SNPs. So in these testing platforms, they know exactly what they're looking for ahead of time. They know they want to look for this particular change, and that's all they're looking at. Whereas sequencing, we want to look at so much more. So we'll look at absolutely everything to try to pick out rare changes that could explain what's going on in someone's health. So I'll talk a little bit more about the SNP word I just said. So SNP, and it's the SNP, it stands for single nucleotide polymorphism. Essentially what it means is it's looking for a letter change in our DNA that occurs really commonly in every population, or in a certain population. So more than 1% of the time. Then in an individual of certain ethnicity, they would have this particular genetic change. So that over 1% in the genetic realm is pretty common. So here's actually a picture of a SNP. See if this, we don't have a mouse. Okay. So here it's supposed to be a G to a C, and it changed to an A to a T. So that particular spot was a common variant, and it switched. And so direct-to-consumer testing would go in and say, I'm only interested to see if that particular spot had changed or not. And then a mutation is something that the testing at a doctor's office is looking for. So that's sequencing. It's looking for things that are rare. So much less than 1% of the population that could be associated with a genetic condition. So these would be changes, and it's not just looking just for a letter change or a spelling change. It's looking for extra pieces, missing pieces, things rearranged in different ways. So it's a little bit more comprehensive in that way. And then I do have a video, because sometimes video helps a little bit more than just talking. Another way of just showing exactly how this testing is done by other companies. See if this will work. She said she loaded it up as well. We'll just play. Oh, yep, and she put it in this video too.
You've probably heard the term DNA sequencing and references to genotyping DNA. Now, let's dive into the defining features of each type of technology. We'll start with sequencing. Most cells in the human body carry a copy of the genome, a set of operating instructions encoded in DNA. These copies of genomic DNA, all derive from the single set of chromosomes formed during conception. When researchers take a close look at this library of genetic information, they see a code comprised of combinations of 4 basic units represented by the letters A, T, C, and G. The total set of genetic information for one person is over 3 billion units long. It contains vast amounts of information detailing how and when each type of cell or tissue in the body should behave. Sequencing refers to the process of analyzing precisely which letter occurs at each position along the code. This meticulous process yields very detailed results. It is possible to sequence a single gene, a panel of genes, or the whole genome, depending on the clinical indication. In a medical setting, interpreting this information can be complicated, as most variation in the human genome has little to no effect on health. Still, other variants have unknown significance. However, when a patient's disease is unknown or difficult to diagnose, sequencing a set of genes can provide the level of detailed data needed to solve the mystery. On the other hand, genotyping refers to a streamlined method to analyze a patient's DNA for variants with confirmed clinical significance. Using a technique called chip hybridization, scientists can simultaneously analyze hundreds of thousands of variants at locations in the genome that are known or suspected to correlate with disease. It's more like a matching test to see if the patient's genomic sequence at a given location matches with any of the known sequences correlated with a health impact. This high-level examination of a patient's DNA is calibrated to yield clear answers for a pre-specified subset of medical conditions. An estimated 99.9% of the genome does not vary among the human population. Ordering a genotyping test will hone in on the variable areas of the genome found to encode many health-related traits. Which parts of the genomic DNA sequence are analyzed in a genotyping run? For different conditions, lab experts have selected a collection of sequence variants and locations to analyze based on their correlation with disease, spacing throughout the genome, and unique sequence of letters. Analyzing only regions with those characteristics reduces the time and cost associated with large-scale DNA sequencing. Some diagnostic dilemmas require the detailed approach of DNA sequencing. However, the information yielded from a genotyping test will also result in a map of genomic locations where inherited sequences influence health.
Okay, so that was just a video just to kind of explaining a little bit about what I was just talking about. With essentially genotyping, you already have to know what you're going in looking for, and it's only looking at those one particular SNPs or base changes, whereas sequencing is going to look at the entire gene or multiple genes. It's going to look at everything. So if you don't really know what you're looking for, or maybe you have a condition you're concerned about but don't really know where the change is at, then the sequencing is more appropriate. So the reason why I wanted to go over all that a little bit was just to help. I'm going to show some examples of 23andMe reports and talk about some of maybe the limitations or not that you may want to consider seeing a genetic counselor, or maybe it was just for fun and you don't need any more follow-up, and that's okay. So this is an actual, and these are just from 23andMe's website, so I don't know who Aaron is or anything like that. But so 23andMe carrier screening. So now they do carrier screening for many different conditions. But it's always important to know kind of what those conditions are and how many variants or SNPs that they truly look at. So in this particular case, this is a patient's report that came back and said that you have one variant associated with cystic fibrosis. And so if you click on, I think it's the scientific details to learn more, and you look a little bit closer, it says you have one variant detected in the test, and it shows you the variant. So that it should be a G, and it was changed to a T. So that was the base pair. They only looked at that one spot and noticed the change, and that came back saying, okay, this patient's a carrier for cystic fibrosis. And you'll notice that they also tested for 27 other things, but those weren't reported. She was negative. So she was found to be a carrier by this testing for cystic fibrosis. Carriers are healthy, so it doesn't necessarily impact her health any for this particular condition. But she might want to consider seeing a genetic counselor for confirmation. So This test is pretty accurate, but it's not perfect. So if you're really concerned about, do you truly carry this, sometimes it doesn't hurt to go talk to someone and say, can you really confirm that I actually carry this genetic change, that I truly am a carrier? Especially if you're thinking about family planning, for instance. Or if they are thinking about family planning, and maybe their 23andMe said, oh, you're a carrier, well, then you might want to do more invasive testing or more expansive testing, apologies, for your partner to see, are they a carrier for cystic fibrosis? Because 23andMe for your partner might only look for those common 27, and if it says negative, that might not be reassuring because there are many, many pathogenic or mutations in this gene that could be influential for having children. Okay. So that's kind of, if you came back positive, reasons why you might want to see a genetic counselor is maybe if you're thinking about family planning or just because you're kind of curious and want to know if it's truly there. If you have a family history, though, of cystic fibrosis and you did this test and it came back negative, that if you know that they were looking at exactly the genetic change in your family, then that might be reassuring. But if you don't know what's going on, what genetic changes your cousin has or your brother has or something like that, getting a negative result might not be too reassuring. It just kind of says you weren't found to be a carrier for only these 27 markers. And there are over 1,700 known mutations in this particular gene. So there's still 1,600 and some odd genetic changes that weren't actually looked at. So you don't know for sure if you're not a carrier for cystic fibrosis. You just know you're not a carrier for those 27. So if you have a family history or you're thinking about family planning, then you might want to go talk to someone about more detailed or that sequencing test to see if you're truly a carrier for cystic fibrosis to predict your risk to have a child with that condition. So that's just one, I just went through one carrier screening report. There are many other conditions that are all kind of the same way. You just kind of look to see what they actually reported or looked for. So a lot of the carrier testing on 23andMe maybe only looks for one variant, so one common change. It doesn't look for every known genetic change in that gene or for that genetic condition. So oftentimes patients will come in and say, oh, I had the 23andMe, I'm not a carrier, I'm good to go. But just knowing that it doesn't look for everything and you might want to do additional testing if you have a family history or of concern of that condition. 23andMe now has these health predisposition reports that they reported out. So these are, most direct-to-consumer tests do require like a medical provider or a doctor to order that testing for you. 23andMe is the one that does not. So anyone can spit in a tube and send it off. You don't need someone to say, yes, I approve, you can have this test done. And it's pretty affordable for most people, but not for everybody. It does right now report 13 health predisposition reports. I'll go through a few of them. It's FDA approved, and they have you go through, for some of them, have you go through like a learning module, you click through and learn a little bit more before you can get your result. You have to agree that you want to see this information because not everyone might want to know their health information that could be reported from these tests. And they have some more sensitive results, they say, than others. So these are particularly the late-onset Alzheimer's disease, the BRCA1 BRCA2 selected variants report, as well as the Parkinson's disease report. So things before I start talking about, your answers you might get from this testing and when you might want to go see a genetic counselor, just a little bit things to note about these health predisposition reports. They're not meant to be used as a diagnostic test. So they're not meant to say, yes, you have Alzheimer's disease or no, you don't. They're not for that. They're meant to see if you have an increased chance to develop those conditions, not that you have that condition. It's not used to make medical decisions, so you shouldn't use these reports to go to your doctor and say, okay, I want you to act on these. They should always do confirmatory testing. Again, it's not to detect disease. It doesn't say that you have or you will develop that particular condition. If you're found to have a variant in one of these conditions, it's mostly just to say, yes, you have an increased chance to develop this condition in your lifetime, but it informs you about lifestyle decisions that you can make to prevent or decrease your chances of developing that particular condition. So it's mostly meant to be proactive, to say, oh, if you stop smoking, you'll reduce your chances, or if you have a better diet, then your percentages are going to go down. And like I said, always requires medical confirmation of the results if you're thinking about acting on them or if you're concerned about them. And yeah, you notice the reports don't ever say, oh, you have like a 25% chance of developing this condition. It just says you have an increased risk or a slightly increased risk. And that's because there are many other things that go into account when predicting your risk. So things like your age, your family history, your lifestyle, and environmental impact, all of that's not taken into account when they see that particular SNP. So those are things that you would go talk to a medical professional about and ways that you could, improve those things to help lessen or decrease your chance of developing that particular condition. Okay. So the first one I'm going to talk to you guys about is late-onset Alzheimer's disease. And so this particular person, Lois, was found who'd done the 23andMe, and she clicked through all the modules, and she saw that she had one copy of this E4 variant that was tested. Okay, so it can be a little overwhelming, especially when you come back positive for anything, or they see anything. It can be overwhelming and be like, okay, what does this mean? How does this impact me? What can I do? So it does usually go through a little bit of stuff, but essentially it just says that you have a slightly increased risk of developing late-onset Alzheimer's disease, but it doesn't actually tell you what the chances are of developing that condition. So, the chance of developing Alzheimer's disease is relatively low, and when you have this particular variant, for instance, your risk might change to maybe a 20% chance by the time you turn 85 of developing Alzheimer's disease. So that's still an 80% chance that you would never develop Alzheimer's disease at all in your lifetime. And it talks about ways that you could, now that you know this, that maybe you would want to take action in other ways, like stop smoking or change your diet, things like that, or become more active to help decrease that 20% even further to like 10% or even lower. So when we see these results, we usually say, it always says, give pause. It doesn't look at everything. It's not looking for early onset Alzheimer's. It's not looking at every gene. It's just noticed that one particular base change and was letting you know about it. And so if you see this and you have this particular report yourself, you're always welcome to meet with like a neurology genetic counselor. I've talked with my neurology genetic counselors. They meet with a lot of families that maybe get this and are concerned. Talk to them about maybe taking their family history, going through and actually giving them a risk for percentage, or talking about the risk for developing late onset Alzheimer's and talking about a plan or ways that they could reduce that risk. So that might be something that someone who maybe gets this result might want to see a genetic counselor talk about. Okay, and the one that most people I think now talk about is the BRCA1 BRCA2 selected variants. So this is, again, generated from 23andMe, but it says, Jane, you have a greatly increased risk of developing breast and ovarian cancer. Obviously, if you weren't planning that, maybe don't have a family history of cancer and you see that, that can be incredibly overwhelming information to receive. And you might just be taken aback and really not know how to handle that. And everyone handles, the information they get online a little differently. But essentially, this test is only looking for 3 SNPs or 3 changes in that gene. They're not looking at all genetic mutations across those genes or even in all the genes associated with breast cancer. So if you have a family history of breast cancer and you're concerned about it and you're negative for these, for instance, this might not be that reassuring. But if you do come back positive, it's mostly seen in patients of Ashkenazi Jewish descent, but not always. There are other people who are not Ashkenazi Jewish who have a mutation in one of these 3 variants. So the reason why these 3 mutations are included on 23andMe is because it's actually quite common. So about 1 in 40 Ashkenazi Jewish individuals have this variant in this gene. So that's like 2% chance of that population. So it's quite common. So it's a SNP, and that's what they choose to look for it. It says you have an increased risk to develop breast and ovarian cancer. But again, it does not mean that you have breast cancer, you have ovarian cancer, or that you will get cancer. It just says we saw this, and this is kind of ways that you can do to kind of decrease your chances or be proactive about your health, now that we found this. Okay. So what if you find that you clicked on this result and you saw that you carried one of these variants? What do you do? So we would recommend then, if you particularly for that one, that you would reach out to your primary care physician and try to get referred to a cancer genetic counselor in oncology. And what they do is the first thing that they usually do is perform confirmatory genetic testing. So that sequencing, that medical grade, they go through all those labs have to go through so much to be medical grade. That's different than the direct-to-consumer testing to really confirm that it's truly there. That would be the first step. If it's truly there, as well as they're going to review your family history. Do you have a strong family history that maybe of breast and ovarian cancer or some other cancer that would have warranted you maybe have gotten sent to genetic counseling earlier and really wasn't? Or maybe you have absolutely no family history and this just happened to get picked up. They'll discuss your screening and prevention methods. If it was identified, what can we do to help limit or decrease the chances of developing a cancer? And what's the impact for yourself now that you know this information, as well as to other family members? Would you want to share that with other family members? how do I even go about talking to other family members now that I found this out? Genetic counselor is there to kind of help you with that, as well as providing you resources and just being an emotional support for those individuals who maybe have learned this information and maybe weren't expecting it, or even if they were expecting it, it's still not information you would necessarily want to hear. So this is the article that Bryant was talking about that came out right after he asked me to do this talk, which is 23andMe had devastating news about my health. I wish a person had delivered it. And it's about a woman, Dorothy, who had done 23andMe testing and wanted to do the health information and clicked right through and clicked through all the modules, not thinking anything of it, and learned that she came back and did have a variant in this BRCA1 gene and was incredibly overwhelmed and didn't really know what to do with that information, the next steps to take. And so I pulled out a little bit of information from her paper. It's a short read, but it's good. So it says, after 20 minutes of Googling, after learning this test result, I felt like I couldn't breathe anymore. My husband wisely suggested I step away from the computer and call my gynecologist. So you can imagine getting that test result, you just like panic. So that was a good first move for her husband. I got the news in the worst way possible online. And I think that varies from person to person. Someone might say, maybe I would prefer to get that information online. It gives me a chance to process things and develop questions before meeting a provider. Or others might be like, oh, I just got these results. I have no idea what to do with them. I'm incredibly overwhelmed, and I'm going to Google, and I'm seeing all this very scary stuff, which sounds like where she fell in. She says, so essentially, she got referred to her gynecologist, who sent her to a genetic counselor, and they did the confirmatory genetic testing. And she said, I got a call from my genetic counselor. She confirmed the mutation. Talking to someone about these results versus reading them in an online report was day and night. My counselor was sympathetic and knowledgeable. So she needed someone there who could answer all her questions immediately afterwards and be there for her, someone that she could call a day later or a week later where she developed more questions and developed a plan for her care. And that's what a genetic counselor is there for. But she kind of goes back to thinking at the end of the article, okay, well, I didn't really have a strong family history of breast cancer. I probably wouldn't have been referred to a genetic counselor given my family history. And if I had never done this 23andMe stuff, I never would have known about this, and I would have developed cancer maybe years later. So she was very thankful that the at-home genetic tests are cheap and available to people like me, so she was able to find this information. So while she maybe didn't want it online, she did realize the value in the direct-to-consumer testing in the end. So I thought it was an interesting read, though. Okay, the last thing I'm going to talk to you guys about before I end is some individuals who do the direct-to-consumer testing get the raw data sent to them. They like to send it off and look at it closer and do what they can with it. And that's to each their own. But essentially, there was a paper published that talked about the chances that there's false positive rates when looking at the raw data. So the raw data is not validated within the testing platform. They don't check it continuously to make sure it meets all those standards of validation. It's just kind of there. So like 23andMe looks at 600,000 SNPs and looks for those changes. It obviously doesn't report all those 600,000 SNPs. That's part of the raw data. The raw data is also not looking at sequencing. It's not looking at absolutely everything. It's, again, just those base pairs and those things that they were interested in. Okay. And so there was a company who essentially has said there were patients who were looking at their raw data, looking for genetic changes in their raw data, found that there was these genetic changes and they were concerned about them. So brought them to their healthcare providers for confirmatory testing, and how many of those were truly positive versus how many of those were seen in the raw data but weren't actually seen in real life later on. So they had 49 individuals who brought their raw data, their genetic variants that were interpreted for confirmatory testing, and these included conditions. Specifically, most of these patients had cancer genetic testing they were concerned about, but there was some connective tissue and carrier screening results that they wanted confirmed as well. And so here's actually was performed, the confirmatory testing was performed by this lab called Ambry Genetics, which is a cancer genetic testing lab mostly. But here's actually the figure that was published. So out of the 49 patients that came in with their genes that they wanted to be confirmed, only 60% of them were actually seen to be truly there. And 40% of them were false positives, where they saw it in their raw data, but when they did the sequencing, the medical grade testing, it actually wasn't there. And then they talk about the genes. They're all medically actionable genes. Again, these BRCA1 and BRCA2 genes, which are the breast and ovarian cancer genes. We have some other breast cancer genes like CHEK2 and ATM. This call 3A1, this is a connective tissue gene. So there was just a variation of different genes that they saw the test results reported from the raw data from the direct-to-consumer testing wasn't truly present when they did their actual testing. And they also kind of look to see because sometimes you can send your raw data off to these companies and they'll say, oh, it looks like this is a causative change or this is a benign change, not causative. And they saw that a lot of the times those that were calling these changes causative they were actually what they would report as benign or common findings in the general population that weren't associated with disease. And that's just because there isn't a lot of communication between testing laboratories about classification. So the big companies that do all this testing aren't really communicating with the direct-to-consumer testing companies to make sure everything is consistent. So I always say, if you're looking at the raw data, just be aware that it might not always be true. Always bring it to your healthcare provider if you're concerned about it to say, okay, maybe can you see if this is truly here and what can we do if it is? But if you have a strong family history of a condition or you're really concerned, just always talk to your healthcare provider about what's the most appropriate test for you guys or for your family or for you in person. Okay. So then the last thing I was going to say is just, overall, just consider to see a genetic counselor. If you're concerned about anything, if understanding your results, that's what we're here for. If you're planning to have children, or you learned that you're a carrier for a genetic condition, maybe you might want to see a genetic counselor. Maybe you have a strong family history of a genetic disease or a disease in general, and you just want to learn more if you should be concerned or not. That's what we're here for. Maybe you have a family history, like I said, a child with a genetic condition, you have a baby with an ultrasound finding, family history of cancer, or just really want to talk about your testing options. You can see a genetic counselor within that particular indication, whatever you're interested in, and we'll kind of help you process through things. But if you feel like you're good and you're not concerned about something, then maybe you don't need to see a genetic counselor. Okay, questions?
To you so that we can get you on the recording.
Thank you. I'm interested in the mandatory newborn testing that we have in Iowa.
Yeah.
Is it genotyping or sequencing type testing?
Yeah, so the newborn screening is like genotyping. So just looking for a few of those genetic changes. If they see, like for cystic fibrosis, for instance, they only look for a common genetic changes that they see. So if they see the individual is carrier for one of those, then they usually do follow-up testing. There's like a bunch of follow-up to newborn screening to really say, okay, was this child actually affected with that condition or was it a false positive? So newborn screening is not perfect, but it's a good question.
We test for a lot of different things, especially here in Iowa.
Yeah.
Has there been an uptake in false positives?
I have meetings with the individual, like the geneticist who does newborn screening every week, and I think they have some areas where they do see false positives quite often, and when they see more false positives than what they would expect, and they always look at their machines and everything like that, just to make sure everything is up to code.
So when you do sequencing as a genetic counselor, do you just sequence the genes of interest or the entire genome? And also, does the patient get a copy of the results?
Yeah, that's a great question. So it all kind of depends on what a family or an individual will come to me for. If in prenatal, if I know that an individual is coming with like a clinical diagnosis of Noonan syndrome, which is a genetic condition, I might only do testing for the genes associated with Noonan syndrome to figure out what the causative genetic change is, especially if they're thinking about risk to pregnancy. Sometimes I have an individual who maybe we just don't know what's going on. So like in pediatric genetics, they might have a child who has a lot of findings that just doesn't fit perfectly with one particular genetic diagnosis. They might do like a whole exome, where they look at a lot of information in sequence, like 20,000 genes, for example, to try to see if they can figure out an answer for that individual. And yes, usually we always give our families a copy of their report because that is their information and they should have it.
Just make it easier and stay over here for right now.
At least I always give out my reports.
I had two questions. I was just curious if insurance typically covers it if the doctor orders?
Oh, that's a great question. So genetic counselors, we focus quite a bit on insurance. which I think a lot of providers, like healthcare providers, maybe just say, oh yeah, that's covered, you're fine. But as genetic counselors, I spend a lot of time looking into the test to make sure that everything would be covered, and if it's not going to be covered, what the actual cost would be for my families to see if that's something that they would choose to pursue or not.
Great. The other thing I was curious about, I had heard sometime maybe after the Children's Hospital was up and running, the Ehlers-Danlos hypermobility type 3, I guess.
Yeah.
It was no longer allowing adults to be serviced, but the children could continue to be serviced. Do you know what that was all about?
Yeah, that was actually something. I don't deal with the pediatric side of things, but I do know about that particular thing. So the Ehlers-Danlos, the hypermobility type, the pediatric and adult genetic clinic decided that they no longer felt that they were the most appropriate people to manage those patients, and so thought that their healthcare provider, like their local primary care physician, could be able to manage those families and patients appropriately. So I think and I think they also lost the main doctor who took care of those families, and so because they lost their main doctor and felt like their primary care physician could manage them appropriately, then they kind of let that clinic go. But I think I hope that they sent out letters to everybody to let them know about that decision. But I was not part of it, but I am aware of that.
Yeah, I heard that they have letters as well, but
Yeah.
it seems like, from what I've heard, most doctors don't know much about hypermobility.
Yeah, I would agree with you in the sense that if a doctor is not aware of something and doesn't, then they need to refer the patient to someone who would. And necessarily if the genetics team isn't taking them on, then they need to find an actual doctor who maybe feels comfortable taking care of those families. Yeah, but unfortunately there are a lot of providers who maybe don't know how to appropriately manage some genetic conditions. Yeah.
A benign question this time. You talked about 5,000 plus certified genetic counselors. What prevents somebody saying, oh, here's an easy way to make some money. I'll put an ad in the newspaper and offer genetic counseling. How do you, is there any thing that prevents somebody hanging out their shingle without any specific training?
Yes, I mean, we have some providers who claim that they offer genetic counseling. Maybe they don't have the training in genetic counseling, and usually there are like top big wigs for genetic counseling that kind of go in at them and say you can't be offering this. But luckily, I don't have to do any of that confrontation. But
So there is no licensing or anything that requires a person who presents himself as a genetic counselor to have any specific training.
oh, thank you. Yes. So you have to go to college for a master's degree, and you have to become board certified and take a big exam. So all of our genetic counselors at the hospital are board certified genetic counselors. And then I was actually working on licensure, so we'll soon be licensed genetic counselors. But, yeah. So everyone, all those 5,000 genetic counselors I talked about should be board certified. Yeah.
So I know that Colleen Campbell has been working for several years trying to get a license for genetic counselors in Iowa. So that's still not the case that you guys are licensed for Iowa?
We aren't, well, we have passed in the licensure, and Colleen keeps working on things. I think it'll be in the next month or two is what I have been told, that we will become licensed genetic counselors.
All right. Okay, I have two questions. Since the demand for genetic counselors are so high, is it still highly competitive to get into genetic counseling programs?
It is. That's a great question. There are, it still is pretty challenging to get into a genetic counseling program, and that's because they keep the class sizes so small. So a lot of these programs, there might be only 40 programs in the United States that do training for genetic counseling, and they might only take like 5 students each. So they keep it pretty small, and it's just because there's not enough genetic counselors to properly train everybody the way we would want everyone to be trained. So it is pretty competitive to still get in, but there's actually been a pretty big increase in the last few years of genetic counseling programs opening. So there used to only be maybe 35 genetic counseling programs, and I think now there's up to 50, and it's going to keep growing. So then we'll be able to take in even more students and make it a little bit less competitive.
And my other question is, what does a standard setting look like? Do you have an office with like couches that the patients come and sit in? Or are you in the clinic?
Yeah, no, it varies from every specialty. You just described my office, but I have an office, I have a couch, but it's not necessarily where I don't want you to lay down and that type of counseling session, but keep it more comfortable and have a conversation, because I don't want to be educating and just being a one-way conversation. I want this to be from both ends and having a conversation. So I try to make it as relaxing as possible. Other centers, they might have like the clinic space where they might just come in and have like a round table where they can meet with a family. In pediatrics in general, they have a clinic where it's kind of like the patient's in a room and the genetic counselor might pop in and leave, and then the doctor will come in and leave. So it really varies from specialty.
We're very fortunate in this community to have professionals and have access to this great information. But in rural communities and other places where people are taking the taking the direct-to-consumer test and getting their results, and I haven't taken one, so I don't know what literature I get back in return.
Yeah.
But is there anything in there that says if there is, if you want to see a genetic counselor, here's where you can locate one? Because I'm sure they're few and far in many parts of the country, and physicians are not always up to date on this information.
Yeah, you were very, very correct in that. There are a lot of physicians that they didn't teach genetics back then, or just don't have a lot of the up-to-date on the genetic knowledge. The tests do say like they'll find a genetic counselor, and so you can see if there's one anywhere close nearby. There in Iowa, while a lot of us are in Iowa City, there are some sprinkled about throughout the state of Iowa. But if it's still too far for families to travel, there are a lot of genetic counselors who just do things over the phone. So they could just set up a phone consult to talk with individuals about everything. And sometimes they do like Skypes if that would be easier, or having a presentation to talk through, because sometimes visuals are a little bit helpful in learning. So trying to reach those rural communities as well.
David has another question.
My memory is that I believe it may have involved the BRCA genes, that a company may have tried to patent them and then force or claim that they were the only one that could test for those genes. I believe there was a court case that broke that. Could you talk about that a little bit, if that's true? And does it have implication for other particular genes that have been identified as important?
Yeah, no, that's a great question. So that particular company was Myriad. So Myriad patented the BRCA mutations, saying that if you wanted testing for those BRCA mutations, you needed to come and do your testing only at our lab. We were the only place, and they could charge whatever they wanted to charge. That has been broken, you are correct. So now they can do that testing wherever that offers it, as long as, and that's where the conversation is, what's more affordable for our families and what's the most targeted test for them. Myriad still offers testing for BRCA1 and 2 and all the other cancer genetics and genes. But some people will choose to go to Myriad, that company that had the patent, because they had it for so long. They have this huge database and know so much more information that they're not sharing with other labs. So sometimes they still have a little bit of that bias from that particular lab. But now other places do offer those testing. There's no patent on any other genes that I'm aware of, but I could be wrong.
Well, that Supreme Court case that ruled against Myriad basically said that you can't patent the gene sequence, and therefore you can't patent a control to assessing mutations in that gene sequence.
Yeah, I think what you said about Myriad is essentially correct. I think the last time I looked, it was a long time ago, there was over 1,300 mutations in the BRC gene. So they don't have to tell anyone else what those mutations are or what they mean clinically. So that's one important thing they still have.
You are correct. Thank you.
Any additional questions? Well, thank you very much for attending. Thank you, Mary-Kayt, for speaking.